The last thing any one of us wanted this week was lockdown, take two. And in the most densely populated parts of the province, that became a reality and took millions back to some of the strictest measures of last spring. Not everyone is taking it all in stride, with some pushing back at this new round of restrictions. With us now from Ontario's capital on COVID fatigue and the week's developments, Dr. Anna Banerjee, infectious disease specialist and associate professor of pediatrics at the University of Toronto, and Jennifer Pagliaro, City Hall reporter for the Toronto Star. I was joking with you both before we started taping that this week has felt like a very long month. So we're glad to have you here to break down some of the week's developments. I'm going to start with a poll from Ipsos. It's a new Ipsos poll for Global News, and it finds that half of Canadians, 48%, say that they're getting tired of following public health recommendations and rules regarding COVID-19, including 15% who strongly agree and 32% who somewhat agree. Fatigue is most pronounced among Generation Z, 57%, Gen X at 53%, and Millennial, 50% of Canadians. Dr. Banerjee, I would like to start with you. You know, as we grapple with the second wave, I think we knew the second wave was coming before, I know we've been covering it from March. As we grapple with the second wave of this pandemic, what do you attribute to this fatigue?
Well, COVID has impacted everyone. People have lost their jobs or have modified their way of living. People have lost income. They're staying at home. They're stressed. So a lot of people have anxiety. We were told wear a mask, physical distance, wash your hands, and everyone did that. Everyone stayed at home when they first told us to. We've made a lot of sacrifices, but when you make sacrifices, you expect a reward. And so far, there's no reward. So I think that people are really tired. We thought it was going to get better in the summer. We all did, we were all in it together, and then the numbers are going up again. It's been 9 months, and I think that and we're told that probably it'll get worse before it gets better. So I think there's a lot of reasons why people are tired.
And people have had to make, because I sometimes when I do hear the term COVID fatigue, it sounds as if people are just over it. When in fact, the points that you mentioned, people losing their jobs, people not being able to see their families. But how do we get people to understand that the situation now is just as severe, if not worse, compared to what we endured in the spring, without contributing to further COVID fatigue? Dr. Banerjee?
Well, I think that one of the problems that we're seeing is that there's an inconsistency as far as, federal, provincial, local messaging. And I think that sticking to the facts, going back to simple principles, we know COVID is spread when people get together. This is why we do what we do. I think also looking at, that there is a light, at the end of the tunnel, that we can do these measures, have it based in science, and that eventually this will end. And I think that that way we can try to get people to continue to do the things they need to do. I mean, I think it will be a difficult winter, but then at the end of this, I think that things will get better.
And Jennifer, Dr. Banerjee mentioned, at the beginning, we had a sense of we're all in this together. We had the posters in the window. And now we have different types of posters saying end the lockdown. How much of a role has this fatigue played in the spread of misinformation and disinformation around COVID? Jennifer?
Yeah, I think the things that Dr. Banerjee said, it's so important, and you see now how that being tired with this pandemic, and as she said, not just being tired, but losing income, losing work, losing all of these different things for our families have contributed to people spreading misinformation about how severe this virus is, about the science behind the tests and the virus itself. And that's really contributing to a lot of discontent that we're currently seeing, out on the streets. Your viewers have maybe seen the protests at Queen's Park for people not wanting to wear masks and other aspects of this virus that have frustrated them, going all the way up to sort of government conspiracy. And so that's really challenging for public health officials who are asking us to continue to follow these measures and these rules.
This is the first pandemic of the social media era. We see a lot of posts going viral on social media and algorithms. What role does that play in amplifying COVID fatigue, Jennifer?
Yeah, I think it's really challenging. We've seen all kinds of things in, the American election. We talk about Russian bots and Twitter trolls. And I can tell you that it seems like there is a full mechanism on Twitter right now that is affecting Canadians, that does come through to Canadian listeners and viewers and those on social media, that is telling them that, this virus is a hoax, that this lockdown is unnecessary. And it's really important to counter that information, but it's very difficult when it's coming at people from all angles like that, and they may be mistrustful of mainstream media. People like me who try to provide solid scientific information and reasoning for lockdown measures. So I think it really does affect people. I have heard just in my own life, regular people say to me, is the pandemic that bad? And I think asking the question is important. And what's equally important is who they're asking the question to. And if they're looking to social media for the answer, I think that's a really big problem.
I mean, I was joking about this week has felt like a month, but for you, this week, you've had a really busy week. And I saw some of the interactions you had on social media. You're in the field, you're doing your job, and the frustration is being directed to you as a member of the media. So, how do you contend with fed up people on social media lashing out at you when all you're trying to do is your job?
Yeah, I mean, thanks for mentioning that. I appreciate it. And it is difficult, obviously, when people challenge you in that way, in a disrespectful way, just for doing your job. There's a lot of people, like I said, who don't trust, what we call mainstream media. First of all, abusive people get blocked and reported, and I have a very supportive newsroom who helps me with that. And for people who are asking legitimate questions, who really are challenging, I try to send them the best information that I have about the reasons for this lockdown. And when people say, well, what scientific evidence? Then I try to send it to them, because the hope is that if they're asking the question, they maybe are willing to really hear the answer. But as far as Twitter trolls, my advice to everyone in my position, or who might, try to fight with someone who they see messaging someone like me or someone they know, is mostly just to ignore them.
And Dr. Banerjee, when we do talk about the messaging, we've done a few shows on the confusing messages from public health officials. We're living in a social media era where disinformation is so available. Do you think that public health officials maybe need to pivot and try different social marketing techniques to try to cut through some of this noise and fatigue?
Yeah, I think so. I think what we're seeing is cracks in the public health system. As I said, we're seeing different messaging coming from federal levels, provincial, and municipal levels, and sometimes the messaging is contradictory. And people are seeing inconsistencies. Like you can have physical distancing, but bars can be open in some places. You no mask, two-layer mask, three-layer mask. We're in lockdown, but in Quebec, you can have parties with 10 people, of different households. So I really believe that people want to do the right thing, but they're discouraged because the information is inconsistent and contradictory, and they don't know what to believe. So I think that what happens is that social media fills that void. Someone puts out an opinion, and it may be a conspiracy theory or another theory where it's not based on any evidence or facts, and then it gets amplified, and people think that it's facts, that there's some basis to it when it's really someone's opinion. And so I think that maybe the people who, physicians, epidemiologists, people that know the science should get out into social media and show the evidence. I think that people want to know why they're doing what they're doing, and that's based in something that's really going to make a difference for this pandemic.
And it seems too that we should be having a conversation also about trust. And Jennifer, working in media, do you think that's part of the missing piece right now?
I think that's huge. I think that's so crucial right now. And it's really incumbent upon journalists like me to make sure that the public clearly understands what public health officials are asking them to do. And like I said, also understand the reasoning behind that. And one of the most difficult things in this pandemic has been that as journalists ourselves, we haven't always had that evidence because it hasn't always been provided to us. And I think that is the fault of public health officials and government officials, because if they want people to buy in, they need to show what they know to people like me so that I can break it down. I can call experts like Dr. Banerjee and clearly explain what the measures are for and why they're being implemented. And, to explain things, like Dr. Banerjee said, people were in lockdown earlier, it got better in the summer, and people are saying, well, why are we in lockdown again? And public health officials tell us that we should expect this virus to come in waves. It's not necessarily going to be a one-off thing until we get a vaccine. And to be able to clearly explain just how, the life cycle of a virus and how that works. And I think we all need to be doing better, because clearly people are dissatisfied, and we see people now unwilling to follow the rules, even though I agree with Dr. Banerjee that most people want to do their best and are maybe struggling with the communication.
Dr. Banerjee, I see you nodding.
Yeah, I just think that we need to keep the message simple. It was very confusing. 10 people you can associate with in your bubble, 10 people you can associate with outside of your bubble, this many people here. It's very confusing. So I think you need to keep the messaging simple, consistent, and based on evidence. And I think that, people who know the evidence should go out there and try to amplify the evidence and their voices, and help people understand why we're asking them to do what they're asked to do, that it's based on something that makes sense.
Well, this past week, Bonnie Lysyk, Auditor General of Ontario, released a pretty scathing report. I'd like to read a quote from a piece that Rob Ferguson wrote for the Toronto Star. Lysyk found the province's reaction to the pandemic was slowed by a cumbersome command structure that sidelines public health experts, including a chief medical officer who has not fully exercised his powers. The chief medical officer of health must also be given powers to use his or her expertise, free from political interference, to give direction and make decisions to protect the public where its health is at risk, Lysyk wrote. Dr. Banerjee, how do we fight COVID fatigue with a public health unit that doesn't seem to be empowered?
Well, I think that there's a couple of comments I have about the report. I think that in general, no matter what we do, we can do our best. The virus is spreading, and the virus is spreading around the world. And some places are doing better, and some places are doing worse. The Auditor General's report, there was some criticism there, and I'll talk about some of my concerns. But some of the issues were longstanding. However, I do feel that the Ford government has been deaf to a lot of issues. And myself, I've actually on several occasions reached out to them. I've also talked to Dr. Tam and the municipal government, municipal public health, to say that these are concerns. And I'll tell you some of them. Like early in the pandemic, it was very clear to me that there were people that had false negative tests. So these are people who had classical symptoms of COVID. They had maybe a partner who was in the hospital with COVID. Clearly, there was nothing else they could have had. And so these were false negatives. And if you look in the literature, about 30% of the people with COVID actually have a negative test when they do have COVID. Now that has implications for contact tracing and basically trying to control the outbreak. If you're only following the 70% of the people that have positive tests, then you're missing the 30%. And I explained this several times to the provincial government, and they just again continuing, if your test is negative, you don't have COVID, you don't need to do anything, you don't need to do contact tracing. And I think that was an example of where this government wasn't listening. And the other example that I've experienced personally, which is a school situation, the physical distancing, where, all the rest of us are supposed to be physical distancing, but then you have a room with 30 kids and they're not physical distancing, despite all the input from the experts in the field, physicians, epidemiologists. And then they have rules where if a child has a viral illness, they go home for a day with a runny nose or sore throat, and then they can go back to school the next day. We know, first of all, children spread COVID. We know that in a large study done in India. We know that children often have mild symptoms of COVID, so just a runny nose or a sore throat. Now, the main circulating virus is COVID. And then most of these kids are not getting tested. So when Premier Ford says schools are safe and we have low numbers in school, well, we're not testing a lot of these kids, and we have
What
false negatives. So I think that there's a lot of inconsistencies there.
I should just add that the Minister of Education, I believe it was yesterday, announced that kids in school will be tested. 30% is a high number. How does it happen, and why is it still so high?
Well, there's a lot of reasons why you have these false negatives. So part of it is, inherently the test is not perfect, and there have been studies, in other parts of the world that actually confirm that there are false negatives. And there was a study in New England Journal of Medicine that basically said if someone has risk factors, exposure, or symptoms, so they have a risk for COVID, ignore the test if it's negative and just assume that they have COVID. And so it can happen because the test, is not a perfect test, but also it depends on the viral load. So if someone is exposed and just starts having symptoms, often you don't pick it up on the first day. Then the viral load increases during the course of the illness, and it peaks after a couple of days, and then it goes down. So you can still be infectious and have COVID, but have a negative test. Also, it might depend on how someone does the test. Could be, issues in the lab. So there's a lot of reasons. But at the end of the day, when you have a third of the people that actually do have COVID, but their tests are negative, those are people that, and the problem is that they're being told, first of all, that they don't have COVID. So, these people have symptoms, they feel horrible, they wonder why they're feeling so sick, and people don't understand, well, your test is negative, you should be back at work. So that's one thing, for people coping, but also for infection spread. Basically, anyone who has symptoms that could be consistent with COVID needs to act like they have COVID, knowing that the test is not perfect. And I've been trying to say that to the provincial government, saying we should, anyone with symptoms, even if a negative test, should act as if they're COVID, because there's just so much COVID out there. It's the main circulating virus right now. And that's, if we're trying to control this infection, only dealing with the positives means that there's all these people here that have COVID that we're doing nothing for. And I think that's really important, but that message hasn't seemed to go through.
I'm assuming we have the test that we have. So what's the solution? Would the solution then be to have multiple tests, maybe have 3 tests to rule someone out from being negative?
You could have, more tests, but again, we have limited capacity for testing. And, do we test every single person several times? Maybe different kinds of tests done at the same time might help. But I think what the ultimate goal is really to control this virus. And so if someone has like the classical symptoms of COVID, I mean, COVID can present as anything, and it has presented as, could be even chest pain or neurological symptoms or rashes. It's all kinds of things. But, there are pretty classical symptoms, like where you have, fever or chills, but the body aches, the joint pain, the fatigue, the loss of smell. Even with a negative test, if you have things like that in this time, you assume that you have COVID, no matter what the test shows, and you stay at home and you keep your family, to recognize that this person may have COVID, and they should try as much as possible to self-isolate, even with a negative test. Or even if you don't get a test, it's just the thing is we're going to try to control this virus. We need to get anyone who's sick to stay out of circulation, and that's one of the ways that we reduce the increase of COVID. I mean, it's going to spread anyway because people are asymptomatic and spreading it, or mildly symptomatic. But I think anyone who's mildly symptomatic should know that in the time of COVID, they should just stay at home. And we have to enable people to do that.
With sick days, maybe?
Sick days, yeah. Enable people to stay at home with sick days, paid sick days.
Jennifer, as someone who works in the media, your job is to disseminate the information to people, to tell them why they should listen to the advice. It's kind of like having 2 parents and they're not on the same page, but then the child being asked to do the right thing. How do you then, do you think that is part of the problem, why there is a fatigue, and maybe why people are deciding to take matters into their own hands?
Yeah, absolutely, I do. And I think this is a huge part of, this question you asked about public trust. And, our colleagues earlier, Kate Allen and Jennifer Yang, uncovered that the Ford government had not been following public health advice when he put in the initial thresholds, the different categories that put us in lockdown or in a red zone or, in a green zone, which is where we want to be. And that's really challenging because, again, I, as a journalist, am trying to show that there is public health advice to follow these measures. But when governments put in measures that aren't based on public health advice, it's really important. It's incumbent upon us as journalists to report that out as much as we can and to hold our government officials to account so that they do base these measures on public health advice so that the public can be confident in following them, that it is the right thing to do. But I do think that governments really erode public trust when they step away from public health advice and implement measures for other reasons, be it, for the sake of businesses or otherwise. And I think as journalists, we have that dual role that we have to tell you what public health officials are saying because it's based in sound medical and scientific advice. But if a government is asking a citizen to do something, it's up to us to ensure that they are asking them to do it for the right reasons.
And Dr. Banerjee, just to follow up on my previous question following their Auditor General's report, as a public health official, do you feel like you're not empowered to do the best job that you can during this pandemic?
I mean, I think that a lot of the policies in place don't are not the best policies for controlling COVID. And I think that when you give that advice, not that my advice is the advice. There are many people that have advice, but I think that when the governments or the people administrating this are not listening at all to the advice, then it allows the infection to spread. And so that's frustrating in a way because I think that things could have been done differently.
And so I guess it would be safe to say that you're also kind of experiencing your own COVID fatigue.
I am. I'm tired. I think we're all tired. I mean, everything I do normally has changed, but I'm doing okay.
Okay. Jennifer, we've seen examples of noncompliance. You did cover this story of a restaurant in Etobicoke that decided to reopen. Um, do you think this is a result of lack of planning from officials, or is this another example of hoping that the public does the right thing?
I think it's both. I think a lot of the enforcement measures in place at a city level are sort of relying on a majority of residents to just do the right thing without having to be subject to enforcement. There's a lot of things like, not having 5 people over to your home right now. It's very difficult for any official to enforce that. It would be very hard for people to know if I'm doing that. And so we're relying on people to just not do that and to know that that is not a safe thing to do right now. But when it comes to this restaurant opening in Etobicoke, they were very public about the fact that they would be opening. They posted that on social media, along with some other unsubstantiated claims about the pandemic, and that has drawn quite a large crowd over the last few days. And that is because each day this restaurant owner has vowed to open and has been serving people food indoors, which is currently not allowed in Toronto under the lockdown. And it was surprising to me when I showed up the first day outside the restaurant and that public health officials weren't already on scene, ahead of opening when they knew that the restaurant would be closed at 11 and that the restaurant would be open at 11. And I think that, you know, they're still figuring out how to deal with, brazen noncompliance like this. And I think it's been a struggle for them.
And Dr. Banerjee, we've heard about, the struggles that public health officials are experiencing, nurses, doctors in hospitals trying to keep everybody safe. When you see something like this happening and you see all those people, he could have opened the restaurant and no one showed up, but people did show up. And I understand out of a city of many millions of people, that was a small number, but they are going to go back into their communities. As someone who's trying to keep everybody safe and you see this, what goes through your head?
Well, it's really disappointing. And I think that I recognize that people are tired. I recognize that people are losing their livelihoods and they're frustrated. And I think that, but then again, people are ending up in the ICU and they're not making that connection that, their behavior directly or indirectly impacts people ending up in the hospital, having chronic symptoms due to COVID, the long haulers, or ending up having severe symptoms like it damaging their lungs maybe for the rest of their life or dying. And so you understand it, but we have to continue to combat that with proper information and rebuilding trust.
It's holiday season. I think everybody, it's safe to say everybody looks forward to the Christmas season. Maybe one the time of the year everybody can see everybody. Dr. Banerjee, when you see that the Christmas season is coming up, the holiday season is coming up, how much worse is this going to get in the next few weeks, do you think?
Well, I think we need to buckle up. I think it's going to get worse in the next several weeks. I think this might be a very, very difficult winter. I think it's going to be hard for many people who are told you need to just basically stay where you're at, and that students really shouldn't be traveling. So it's a very different time of year. But I do think that there is a light at the end of the tunnel, and if we can get through this next difficult period, I really do believe it will get better. And I think with the vaccine on the horizon, we know that there's some ambiguity as far as when it might happen. But the fact that there is a vaccine for this, there's some viruses we don't have vaccines for, but that there is a vaccine, it seems to show promising impact as far as reducing COVID. It works to some degree or another. So I think that's very positive.
Well, you have the ears of Ontarians. What would you say to Ontarians who are watching this program and listening about how to manage the next few weeks?
I think it's really important to recognize that COVID fatigue is real. We're all really tired, and I think the anxiety, the stress that people are feeling, it's real, and I understand. It's probably justified. It's been difficult. A lot of people feel hopeless, but I think I want to reiterate that this is going to end, and I believe it's going to end in the next few months. To the degree we're not going to be where we're at, I think, in March or in the next few months. We just need to get through it. And I think that there are things that people can do to try to help. I know it's I don't want to minimize anyone's suffering, but I think that for me personally, what I do is I take stock of what I have. And I think every day I think about gratitude.
Mm.
And I think that all of us can try to support local businesses, restaurants. I think the federal government, if they can try to keep the businesses open for the next little while, support them, not keep them open, but keep them floating for the next little while. If we can support people to stay at home when they're sick, then that reduces the spread. I think also this is an opportunity that we may not have again until we retire. We actually have some free time. Maybe some people don't because they're working and they've got their kids, but for a lot of people, they have free time. So maybe take that course that you wanted to, photography course, start writing, go outside, go for walks, get bundled up, go for walks, go through your address book and find friends that you haven't called in a long time and keep in touch with them or have Zoom calls, reach out to each other. I think journaling is a good idea. There are things that we can do that can help us get through this difficult time.
I think it's important for all of us to know that we are going through this, different people in different ways, but this is something that will not go away if if we're all not on the same page. Jennifer, do you think that the promise, Dr. Banerjee mentioned the vaccine, do you think that the promise of a vaccine looming on the horizon might relieve some of this anxiousness that people are feeling right now?
I do think it helps people feel a little more hopeful. I've had these conversations with my friends and family, but I think that when we're talking about it with each other and when media is talking about it, we need to remind people that it's another reason to keep being vigilant as we go through the winter. It's not the time to kind of give up and get sloppy just because the vaccine is on the way. That would be a real shame if things got really out of control before the vaccine arrived, but it is a reason to kind of hold on and have hope. And I agree with Dr. Banerjee that, I'm saying this as a white person with a lot of privilege, and there are people in this city who are really struggling, who have to go to work at an essential job out in the world every day. But to the extent that we can, practice some form of mindfulness at home, whether that's going for a run, doing something, that's low barrier, low cost, home exercises, home meditation, and checking out from the news cycle every once in a while. And I know that's weird coming from a journalist, but it is important to turn off and spend time with your family, or if you can, call someone if you live alone, and maybe go for just a walk out in nature like Dr. Banerjee suggested, and just to continue to follow the advice until we get through this.
Dr. Banerjee, like you said, with gratitude, I always try to find something about silver linings, every day having a silver lining. We really do appreciate both of your time and are so grateful for the work that you're both doing. Thank you so much for your insights, and take good care. Thank you.
Thank you.
Thank you so much.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.